Hey, welcome to Below the Skirt with Tamara. My name is Tamara Green, pelvic physical therapist, helping you live your best life below the skirt. And I help women overcome that uncontrolled bladder, return to that pleasurable sex, so you can manage those pregnancy symptoms so you become a postpartum champion. So, my girl Virginia, she's always here with me, educating you. But I wanted to be discussing today when it comes to what a hernia is. How do you find a hernia? And you may say, well, what is that? Well, a lot of times you may notice that it's a bulge. And I don't diagnose a hernia, but this is something that you can check on your own. You may have a bulge in this area. So if this is your pubic bone right here, if you go a little bit above here where your belly button is, you a lot of times it's very common to see it just above the belly button, or you may notice it in the groin area. So if I were to stand up here, if this is my belly button, a lot of times you will notice it more just above the belly button. And if this is my groin area here, if this is my groin area here along that panty line, you may notice it right in here, but it's very common to see it here. Now, you may say, well, how am I able to see or know if I've had it? Again, it's like a little bulge. In some people, you may notice a severe bulge. So if I am lying on my back, say I'm lying on my back, lying on my back, when I sit up, I may notice like a dome shape or a rise when I sit up like this. Or if I'm trying to pick something up, if I'm trying to pick something up, or I may try to cough, during that component of time, I may notice like a bulging area. And that bulging area could be very uncomfortable. It could be very tender. That spot could be tender. So what you can do is just to check it yourself. You can lie down on your back, and when you're in a relaxed position, touch those areas that you notice that bulge, particularly more common above the belly button, what we call abdominal hernia, or inguinal hernia, which is on the sides along that panty line. If you're lying down with your knees bent, just relax, and you press on those areas where you notice that bulge, you may feel like, I don't feel the bulge, or it's not as tender. But then when you sit up or put a little bit of strain on your body, like lifting up the upper trunk, you may notice that spot, you feel that bulge and you put pressure and it's very, very tender. Or you may be lying down on your back and you're trying to really lift that leg up and it's a strain and you feel a bulge pop in that area, or it's very, very tender when you touch, when you give some type of, when you're straining on yourself in reference to lifting or in reference to sitting up. If you notice that tenderness, that could possibly be a hernia. And there's different grades of hernias. Some are very, very large. Some can be very small. Now, is it something that could be really, really fixed? It just all depends. What you can do is you can strengthen certain areas. In some areas, depending upon how high or how big a hernia the hernia is, it may need to be surgically repaired. So it's just where there is a weakness in some tissue, like if this is the tissue, there's something is protruding through, right? It could be anything. Something could be protruding through, and with that protrusion, that's where you feel that bulge, or that's where you feel that tenderness. So what do we say? Okay, certain things you need to avoid. What do you need to avoid? You need to avoid doing any strenuous work. Strenuous lifting, pulling. And you may say, whoo, I think I have a hernia. That is your cue, my lady, to tell your significant other, partner, or whatever makes your heart happy, that you may need to let your hands relax a little bit, because what? You should not be straining. But no, but seriously, on that note, just making sure that you don't want to do any strenuous work, because strenuous work can put more of a strain and increase that hernia. Now, if you say, well, I do have a hernia, what could I do? That's the most definite ways to prevent making the hernia increase. But how can you help control or decrease or manage it? Because you can manage it for many, many years. Now, that is where strengthening comes, specifically when it's a hernia of the abdominal region. You can work on strengthening, you can work on some type of taping taping that kind of holds things together. But if you're working on strengthening specifically, if you have a weak core, and I've said it over and 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 over again and over again, that a weak core can increase your risk of having a hernia. Say that with me one more time. A weak core can increase your risk of a hernia because those muscle tissues are not firm. They're not, with them not being as solid as they need to be. Then you can have some issues where something is poking through because of a weakness. Again, it's just like you've heard people say before, like you're only as strong as the weakest link. If that link, that area is very weak, you're increasing your risk. So it's very important, specifically if you've just had a baby or you've had a baby, it could be a year, 2 years, 3 years, and you've never really worked on engaging your core. So if that's the case, strengthening, stabilization is key to maintaining, decreasing your risk of having a hernia. Now you may say, hey, I've been trying to do it, I've been working on strengthening in that area, and it just is not helping, or it's very bothersome for you. Definitely get assessed by your healthcare provider, to your doctor, to see what, how severe it is, to see what steps you may need to take, because it may be something that you cannot fix on your own. You may need a little bit of assistance, because a hernia can also be so severe, it could definitely cause some other health medical issues that you need to be aware of. So it's not just about having a little bit of pain or decreasing in pain. It's very important in reference to how you can make sure you maintain that area so it doesn't cause any other health issues. So if you notice a little bulge or a little bubble, or you feel like something dome is showing that is tender, and you notice it specifically when you strain or when you lift, that could possibly be a hernia. So make sure you check yourself out. And that is my tip for today in reference to, do you have a hernia or do you not? And if you do, those are some things that you can do to help decrease your risk of having or further increasing that hernia, and ways that you can help manage the symptoms of the hernia to decrease that pain that you may be having. So have a fantastic rest of your Tuesday.